Good morning. So 30 years into phacoemulsification. One day I was left in the lodge. It is not moving. Yeah. After doing my rexis and hydrodissection delineation, I found that the phaco handpiece was not working, and that was my standby Phacomachine. So how to proceed to remove this nucleus? I used these simple instruments available with us, a 26 gauge needle bent at the hub with the bevel facing to one side, a blunt chopper, cartridge with an injector. Go in and do my bimanual IA, take off the cortex and the epinucleus from the anterior surface, hook the equator of the nucleus, and then go with that 26 gauge needle and get a neat chop. Turn it 90 degrees, and then once again hook the equator, get the next chop. Rotate and divide it into 4 quadrants. One quadrant is nudged into the anterior chamber. The cartridge is introduced into the anterior chamber at the pupillary level. With a Sinski's hook, you stuff the nucleus into the cartridge tip so that most of the nucleus goes into the tip. Loose, powdery nuclear material remains in the anterior chamber, which is visco-expressed. Once again, the next quadrant, go in with your cartridge, use your left-hand instrument, stuff it into the cartridge, take it out, and then do visco-expression of the residual cortex and the nuclear material. These finer materials come out very easily, and when it comes to the last piece, once again, the same thing is done. No damage to the endothelium, no damage to the PC, and the epinucleus is visco-expressed. Bimanual IA of the cortex, you can use your Simcoe. Then you go in and implant the lens under continuous irrigation through the 2.8 mm incision, dialed into position, OVD removed, moxifloxacin injected, the wounds are hydrated. 5.5% was my endothelial cell loss count, much better than phaco. This procedure of cartridge-assisted cataract surgery can also be used when you do your phaco and you end up with a PC rent. Inject a dispersive OVD behind the nuclear material, covering the PC rent. You go in with your cartridge, bring that nuclear bit to the anterior chamber, push it in, stuff it into the cartridge, and take it out. This goes on very smoothly. There is no fear of dropping the nucleus down back into the vitreous. You have one small bit remaining, go back again, gently, take your time and put it in, then go in with your vitrector, do a nice vitrectomy, get a 3-piece IOL into the sulcus and get an optic capture. So here, when you have a PCRN, there is no need to continue using phaco with the risk of dropping the nuclear bit. There is no need to scaffold. There is no need to put in a new scleral tunnel incision. So hence, dear friends, here I present cartridge-assisted cataract surgery as a primary procedure for cataract surgery through a 2.8 mm incision with no phacoemulsification, no femtolaser for nucleus up to grade 4. It can also be used, remember, it can also be used when you have a phacoemulsification with a PC rent.
So please, your time is.
Thank you so much. You can use your SICS nucleus to learn this technique in vitro. Thank you so much.
Professor, have you ever done studies about endothelial cell loss?
That is what I showed, sir.
No, but then you are saying it is better than the phaco?
It is definitely better than phaco in my hands.
I would.
Because of the 3 reasons. There is no energy spent in the anterior chamber. 1, 2, there is no continuous flow of fluid in the anterior chamber. 2. For these 2 reasons, the endothelial count will be much better than phacoemulsification.
Okay, but you don't have any study comparing the 2?
I have studied because in my hands it's about 8% for phacoemulsification. 8% endothelial cell loss for my phacoemulsification.
No, but the video which you showed, there was a lot of manipulation of the nucleus, divided nucleus, and
that happens at the pupillary plane. That happens at the pupillary plane. And the nucleus is just nudged into the tip. It easily goes into the tip because it's a 2.8 mm. It's a large bore cartridge.
Thank you so much.
One more question.
Is it possible with grade 4? I think it's very difficult for grade 4.
Yeah, grade 4.
Impossible, I would say, yeah.
It is possible, but it takes slightly more time. The average time for me now is 14 minutes, but for a grade 4, it takes at least 25 minutes.
After putting the nucleus in the cartridge, what do you suck it?
No, I take out the cartridge.
How do you take out the cartridge? Because
No, it
you
is
have
in the handle, right?
right.
So I take out the handle and we express the residual nuclear material. What now I am working on, I am working with Dr. Kakadia on getting a small flow machine to be attached to this cartridge so that once the nuclear material is inside the cartridge, it can simply be slowly sucked out without an AC loss.
Because the moment you suck it, there is chances of AC collapse. Anyway, thank you very much.
There is no chance of AC collapse here because we are continuously, the cartridge is filled with OVD initially itself, so that once you stuff, that is being simply replaced. So the AC remains stable, absolutely stable.
But you use the word visco expression, that's why. Yeah.
What gauge of needles you are using for grade 2 and grade 4? Are they different?
No, it's only 26 gauge needle. It
Very
divides very well. For
very-
all my phaco emulsifications, I do a pre-chop with my 26 gauge needle.
Very innovative.